Hi, everyone. This is Dr. Erica and Mary Bookwalter. Mary and I just got back yesterday morning from a whirlwind trip to Atlanta, Georgia, actually to Marietta, which is the home of Life University, which is a chiropractic university, or as they say in Atlanta, Laugh University. And we took a course nearby called Torque Release Technique. Torque release is several decades old, having been invented and continuing to be developed by Dr. J. Holder. Dr. Holder has an illustrious career in chiropractic, and he is responsible for not only creating the technique, torque release, but also the instrument called the integrator that's often used for it, and also for founding a program on addictionology to help people recover from addictions of all different kinds, and including a multi-spectrum way of addressing it, including chiropractic, auriculotherapy, and other things. Very interesting stuff. Torque release technique is a chiropractic technique which focuses on attempting to identify and correct what are called primary subluxations. What is a primary subluxation? According to TRT, it is the subluxation, usually one or two at the most, maybe three, which are creating the most impactful, in a negative way, irritations to the nervous system. So they focus on the segments of the spine where there are direct connections between the spinal cord and the vertebrae. This connection anatomically is known as the dentate ligaments. And the idea is that if you correct these subluxations, which are primary, that it will clear, in fact, the whole spine in the way that it needs to be cleared. And this, relative to other chiropractic techniques, is different because in many chiropractic techniques, there is a possibility of adjusting either a few, one, or many possible subluxations of the spine. Dr. Holder and TRT holds that this is not really the case. There's usually one, two, or maybe three things that need to be addressed, and then we leave the spine alone. So on one hand, it's a very minimalistic technique. It takes very little time to do, but it may, if it does what we're hoping it's going to do, create more impactful results. So I've been in practice now, 20 years or so, and I have learned many different techniques. And so I have never been married to any one technique, and I don't plan to be either, by the way. But I'm always approaching new techniques with skepticism because I never believe that one technique is the right thing for every single person. So when I bring a new technique into my office, I want to look at, does it work? Does the patient really feel results after me using it? Also, does it show clinically, do the results that we find with one technique show up in other techniques? So if I do TRT, let's say, and then I reanalyze the patient with a completely different technique like activator or Thompson or something else, am I going to see that the spine has really cleared on several different forms of analysis? That's me. I'm crazy like that. I want to make sure that I'm not just doing things by faith or a knowledge of the profound philosophy, by the way, of TRT, which is very traditional chiropractic philosophy, but also based on what I see with my own eyes and my own hands. So what else do I want to share with you? Oh, you know what? So what I want you to hear for a second is Mary's experience. She's never been to a chiropractic seminar before, and she went down there to learn with us, and take it away, Mary.
Well, I thought it was really interesting, and I feel like I know I got a lot more out of it than Dr. Erica did, mostly because I'm still learning a lot, and a lot of this stuff, a good amount of it was review, which was really good for me and for other students who were chiropractic students there, and I thought it was really good how he went over everything that a subluxation was and the importance of the alignment of the spine and how it really does affect every part of your body and how it really is important to have your spine in alignment, and that just makes everything much better day to day, long term. It's all good. And when he went over the actual protocol, I thought it was really interesting because I thought that's so simple. It sounds too good to be true. Like, I know when I'm taking notes, it's very, like, most people have at least one, if not a handful of subluxations that Dr. Erica will correct, and then after that, but a few takes a little bit of time to correct, but his protocol of the torque release technique was about a minute and a half, maybe. It was very quick.
Very quick.
And I just thought, like, how does that actually get it? But the thing is, it does actually make sense that if you clear the primary subluxations, and the rest of them should fall into place. But I just thought, even though I was actually seeing him do it, it just seemed like maybe because he's been doing this on his patients, it works for them, and it works for them, like, you know. But I just thought, I'm not so sure about it. We'll see what happens. And then today, as you were trying it out, it was really interesting. After you did it on a few people, they'd stand up and be like, wow, actually, I do feel much better. And it was just instant. Yeah. And I thought that was really cool. And I took away a lot from this weekend.
Cool. So that's what we did today. I was like, you know, let's just take a few of our trusted practice members and see what they think. And so we chose a few people, and I adjusted maybe 1 or 2, I think at the most 3 segments, but most people 1 or 2. And I said, you know, just for grins, get off the table and tell me what you think after this. I said, I know it's only like a couple of things and it was really quick, but tell me what you think. So they said, okay, you know, no problem. And I told them about the technique and that I'm trying it out and that I want their feedback and so forth. Excuse me. And each patient did get off the table and say, wow, that's really amazing. And one lady who came in has a lot of fascial issues, a lot of tightness and tension within muscles, and she had restriction both of her hip joints, and she was trying to kind of move the hip out into motion. She said this was really tight when she walked in. I said, well, you know, let's see what happens when I do this technique. So I adjusted on her her atlas, which is way up here, and also on the sacrum. I never touched the hip, actually. And I had her get up afterward, and I said, I know I didn't touch the hip, but tell me what you think. And she was actually motioning her hips out. She's like, wow, that's really amazing. You know, I really do have some more motion. So I did continue to address one of her hips with a different technique, with activator technique, just to kind of balance her out a little bit more. But we were both really taken aback about how quickly she felt a difference, and especially since we weren't working locally to where she had her symptoms. So that was really interesting. And I continued throughout the day to check the TRT results and reflexes along with other techniques to see if it was really clearing things. And so far it seems to be doing that. I think I only adjusted maybe a couple more segments on a few people, but it was really very minimal compared to the many other segments I would, you know, check and also correct. So that was kind of cool, I have to say. So, you know, the thing is, my jury is not out. I really like to take my time with this, but I wanted to share with you what we're doing. I'm thinking that maybe on our next Sunday or so, that maybe we'll have an open house around TRT and have some people come in and experience this. So, you know what, I'm going to check the calendar and make sure Letitia okays this. But maybe what we'll do is invite some people in just to hear about this technique and the history of it, and come and experience it. And you'll let me know what you think. What else? Anything else so far? Before we leave you today, and I promise I'll get you more details about that open house, does anybody have a question or anything about what we just discussed? You know me, I just get online spontaneously and start talking to you about these things because I think it's cool. Any questions before I let you go today? Thank you to Erin and Ben and Nina and Amy and Ellen and Susanna and Liz for joining us today. All right, well, thank you so much, and we look forward to speaking with you more about TRT and all good things chiropractic. Have a great day. Keep warm out there.